Now, often patients present seated in a waiting room. And if you have the opportunity to watch patients in a waiting room, I think it helps us begin to develop strategies on which way we want to treat them. If that's the way you treat. So for example, if someone's sitting, they could be leaning over to the left with their armrests. They're pushing down with their arms. There are disc height changes when people use their armrests. I was lucky enough to see that in my latest study. So if they're pushing down, they could be in flexion and pushing down, for example. And, you know, often you're thinking it's facets in flexion, right? So they're trying to unload the facets. Another thing that you want to watch is when they get up from being seated. Does it take them a few steps? We know that disc height loss happens with sitting, and you know, the hydraulics are, you know, there's a net efflux through the end plates because of the compression on the disc. And when they get up, it takes a few steps, so you can suspect, you know, either discogenic, which of course is going to be a discogenic component, or whether there's also facet related things, because the facets are going to be imbricated a little bit. Once they stand up, the disc kind of rises up a little bit. So of course, watch them you know, come into the treatment room if you can do that. That's a great opportunity to. Now, the reason why I think it's important that we watch them carefully on the way in is then we can let them know that we're paying attention how they're presenting. And we can correlate that with the model